So so before we begin with the questions, if you could and let me know if I'm pronouncing your names correctly. Dr. Banick, if you can go ahead and tell everybody a little bit about yourself and what you've been up to the last few years.
Sure. So my full name is Rudrani Banick, but I go by Dr. Rani for short. And I'm a board certified ophthalmologist and a fellowship trained neuro-ophthalmologist. And I was in academic medicine for quite some time, for many years, until I discovered the power of integrative and functional medicine. And now I use a lot of those principles for my patients to help them support their eye health and their brain health. So I have a big focus on nutrition and lifestyle for vision health in my practice.
Great, thank you. And Dr. Tollefson?
Yeah, Tollefson, but
Tollefson.
that's
Tollefson.
no problem.
Yeah. All right, great.
No problem. Michelle Tollefson, no problem at all. So I'm a board certified OB/GYN by original background and training, though my focus has really been lifestyle medicine for women, which is just the use of evidence-based healthy lifestyle behaviors, including nutrition, physical activity, stress management, sleep, and social connection to prevent, treat, and sometimes reverse chronic disease. So I have been spending time. I'm a professor at Metropolitan State University of Denver, where I created and oversee the first Bachelor of Science in Lifestyle Medicine in the U.S. And so that's been really exciting to be able to work with that future generation of healthcare professionals. I serve on the executive board for a nonprofit organization. I've helped with the American College of Lifestyle Medicine, and then became a cancer survivor and thriver of breast cancer about 4 years ago too. So busy in a lot of different areas.
Great, thank you. And so it sounds like both of you kind of started off with more traditional background and then kind of moved into a more holistic approach. So I'll start off, Dr. Tollefson. I'm sorry, and correct me, I want to get it right.
You're fine.
Um, so how was that received when you made those changes? Were your colleagues like, "Oh, that makes sense," or how do they respond to you going from prescribing medications to probably, first to perhaps looking at a more holistic approach and then prescribing medications second?
Sure. So I grew up in a household that we ate healthy meals. My mom cooked home cooked meals with ingredients from my dad's garden. We exercised. I got enough sleep. I wasn't super stressed. And then I went to medical school and an OB/GYN residency, and my home cooked meals were replaced by drug rep lunches, middle of the night trips to the McDonald's in our hospital basement. But I would try to get the healthier options, but still it was the McDonald's in a hospital basement. And I didn't get a lot of stress. There was a lot of sleep, and I rarely exercised. So my lifestyle just totally changed. And I was really surviving. I wasn't thriving. Like I was just like making it through day after day after day. And so when I finished my OB/GYN training and I got out into private practice, I was like, I need to do something with my own health. I need to get back to where I was at before. I moved home to Colorado, which is a pretty healthy state. And I was like, I need to get myself back on track as far as nutrition and physical activity and stress and sleep. And so I started to dive into the literature because, like most physicians, we're not taught a lot about nutrition or movement or stress or sleep in medical school or residency. And so the more I learned, the more I was like, oh my goodness, there's evidence out there as far as nutrition and PMS symptoms or nutrition and all these different health conditions. And so I was excited to find out that in addition to the conventional medicine that I had been trained, the surgical approaches, the prescription drugs, that there were also all these different lifestyle behaviors that had evidence behind them too. And the more I shared them with my patients and then myself, it was the healthier I got, they got healthier, and it was almost like I found a secret superpower in lifestyle behaviors. So I started to incorporate those more and more, but it's hard with a big busy schedule. So I eventually kind of took that turn toward academia and volunteered at a nonprofit clinic where I was able to do more of that. But it really is challenging. It really is challenging for physicians who want to focus more on lifestyle as medicine in a system that really prioritizes fast visits and prescriptions.
And how did your colleagues perceive that change? Did they embrace it? Did they understand it? Did you enlighten anybody? Was there pushback?
Yes, so I definitely believe that I've enlightened people over the years, and now as a professor, I've been able to enlighten so many people. So I feel really excited about that. I was part of the American College of Lifestyle Medicine when there were only like 150 of us, maybe 15 years or so ago. Now there's over 11,000. So I would say people are definitely awakening that the literature is here, the time is now. At first, I did meet more resistance. I would say maybe like 20 years ago or so, when there would just be certain people who are like, that never works. And I'd be like, I'm going to try, I want to teach them about all these different things. They'd be like, there's not enough time, or it doesn't work, or I've tried that before. And so for me, it was really looking into the literature and then sharing that literature. And then as I embraced more healthy lifestyle habits, I just felt better. And people would say, like, what are you doing differently? You seem like you have more energy. And so I would bring a large bean dip to work, and I would share something that I had with others, and they would try it and say, "Oh, that's good. What's in that?" So I think just like little by little, it built. I was able to build that up, but yeah, it was a challenge. I think anyone kind of leading in this different area, or pushing for a more holistic viewpoint within our conventional medicine has challenges to navigate.
Okay, and how about you? What was your experience like?
Yeah, so similar to Dr. Tollefson, during my early years as a doctor, I had a horrible lifestyle, eating poorly. I was living off of pizza and ice cream and Diet Coke most of the time. I didn't sleep much. I had a lot of stress. And so this went on for actually decades. And I really thought I would be immune to all of those after effects of this horrible lifestyle. I never thought it would really affect me, but it did. It eventually caught up with me. And I had migraine headaches once in a while when I was younger, but when I reached my mid 40s, my migraines got really bad. And basically, I developed a migraine every single day. I developed chronic migraine. And the ironic thing is, as a neuro-ophthalmologist, I treat many patients with migraine. And the way I was taught to treat patients would be to write a prescription, like take this medicine, your headache's going to get better. And so I thought that was the best way to treat my migraine. And so I went to some of the top headache specialists in New York City, which is where I live and work. And all they did was they kept writing me prescription after prescription after prescription, and nothing was working. So this went on for about 3, 4 years, and my migraines weren't better. And I said, you know what? There has to be a better solution. So I started to research on my own, and I realized, wow, there's actually literature out there on the use of supplements for migraine, like magnesium and riboflavin. There's literature out there on the use of diet and lifestyle. Yet none of my doctors had ever mentioned anything like this to me. So I started to do some work and, learn about what I needed to do and make some changes in my own life. And that's when I discovered functional medicine. One of my colleagues said to me, like, why don't you try an elimination diet? Maybe that will help your migraines. And I said, well, what is an elimination diet? I'd never heard of one. And so I looked into it, and then I discovered the Institute for Functional Medicine, and I was completely blown away. I went to one of their week-long conferences, and I said, wow, this information is so powerful. Why was I never taught this in medical school? I was never taught any of this about the power of nutrition and lifestyle. And so I really changed my life in such a deep way that I decided to get certified in functional medicine. And what ended up happening was that I ended up quitting my job, my full-time job in academia, to open up my own practice. Now, I still maintain a position at the university, and I still teach, but I felt like I needed to get this information out there to the world, and I wouldn't be able to do that in an academic setting, having only 10 or 15 minutes with each patient. I needed to spend more time with each patient. So it really has changed the trajectory of not only my career, but my life, because I'm so much better now. And I try to now share this information with my patients to help them as well.
So, so what happened, Dr. Ronnie, to your headaches?
They got much better. Now, there's no cure for migraine, so it's always kind of there. There's always the potential for having a migraine attack. But instead of having a headache 30 days out of the month, now I'll have a headache maybe 1 or 2 days out of the month. And that is such a huge, plus. I can't even describe like how incredible it is not to wake up with a headache every single day. So I'm a true believer in the power of nutrition and lifestyle, and some supplements too when appropriate.
So, Dr. Tollefson, you had mentioned PMS, and it seems that everything, that is natural has become medicalized. And, if you have a problem with PMS, they give you Advil or whatever to help with that. What natural remedies do you find work to reduce PMS?
Yeah, so great question. So like with so many of the different women's health conditions, and so many of our health conditions in general, especially those that are partially linked with pain, there's a connection often with inflammation. And so I am not anti-conventional medicine at all, but starting with some of those food basics, so trying to decrease inflammation to have a healthy gut microbiome. So getting enough fiber. I'm a huge fan of fiber. Fiber is fabulous for females. It's good for everyone, but the three F's, fiber is fabulous for females. So trying to get my patients and others women to eat at least 25 grams or so of fiber a day. The American Institute for Cancer Research recommends about 30 grams of fiber a day, so even higher than that. But really an anti-inflammatory diet. So one that limits ultra processed foods, one that, and avoiding soda, focusing on fruits and vegetables and whole grains and nuts and beans and seeds, all of those different things. So yeah, so for PMS, but really the foundation of women's healthcare, foundation of all healthcare, I think we start with a nutrient-rich, anti-inflammatory, plant-forward diet.
Great, thank you. And Dr. Ronnie, when people think about the eye, they don't necessarily think of nutrition. Maybe carrots. I think they had some, back in the day, they used to say carrots were so good for your eyes. How does plant nutrition affect eye health, and what types of issues are you able to address with lifestyle changes in nutrition as opposed to traditional medicine?
Yeah, so plants have lots of nutrients. They have vitamins, they have minerals, they have antioxidants, they have bioflavonoids, and all of these compounds can benefit our eyes. Our eyes are actually quite complex, even though they're relatively small, about the size of a golf ball. Within the eye, there are over 40 different structures within the eye, and also there are over 200 different cell types at last count. There was a study published just in December of 2023 that found at least 200 different cell types in the eye. So we need a variety of nutrients to support all of those different structures in the eye and the cell types. And so plants provide us with many of those nutrients. I would say almost all of those nutrients. And so when it comes to eye disease, for example, the most common types of conditions that can lead to blindness as people get older include cataracts, diabetic retinopathy, glaucoma, and macular degeneration. And all four of these conditions can be prevented by having adequate nutrition in one's diet. There are actually studies to show that if you have a plant-forward diet, a plant-rich diet, then your risk of developing macular degeneration is anywhere from 43 to 47% less than someone who has a diet rich in processed foods and high in red meat, et cetera. So there is research that has been done with regards to some of these conditions, but not all of these conditions. So this is still an emerging field, and I hope to be helping to promote the field and raise awareness and just educate people about what they can do using natural means, using their diet primarily, to help prevent vision loss in the future.
And what if you could recommend just a few foods that people could add in, or supplements to add in for eye health, what would you recommend?
So first, we should talk about the nutrients that are important for eye health. And I would say if I had to choose like the two top nutrients, I would say lutein and zeaxanthin. These are carotenoids. They're called macular carotenoids. They're cousins to vitamin A and beta carotene and lycopene. So these macular carotenoids are powerful antioxidants, and the foods that best provide them tend to be the leafy greens. So foods like spinach, kale, arugula, any type of leafy green, whether it's mustard greens, dandelion greens, Swiss chard. These leafy greens are very, very rich in the macular carotenoids. But also, as I said, there's a lot of nutrients our eyes need and many foods that can provide those. And so if you were to ask me, okay, what's another nutrient class that's important? I would also say the omegas are very important, in particular omega-3s, DHA, EPA for eye health. By the way, a fun fact, the highest concentration of DHA in the body is actually in the retina, in the retinal photoreceptors, higher than even in the brain. So it is important to provide our bodies with those omegas. And there are many different foods that can provide those omegas, ranging from seeds and nuts to certain types of fish as well.
So you mentioned DHA and EPA, and there's talk in this, like in the whole food plant-based world about whether or not we convert uh, DHA and EPA from our diet properly. And some doctors like Joel Furman talk about needing supplementation. What are your thoughts? I mean, do you find that to be true in your practice when you suggest that to people, or do you find that they can get the necessary nutrients through their diet?
Yeah, so I think that point is very important that not all precursors of the omega-3s get converted to DHA and EPA. So, for example, ALA, which is the precursor omega-3 to both of those other omegas, is found in seeds, like, for example, chia seeds, hemp seeds, flax seeds, but not all of it will get converted. So in my opinion, yes, if one is not eating animal products, then probably should be supplementing. I myself happen to be vegetarian, so I definitely take a supplement, an algal supplement to get my omegas in. So I'm a believer in that.
Yeah, thank you. And do you have any thoughts on that, Dr. Tollefson?
Yeah, no, I agree with what Dr. Banick shared as well. I take my algae supplement as well. I'm a whole food plant-based. So yeah, and omega-3s are great for so many different reasons.
Okay. And Dr. Tollefson, you're a breast cancer survivor, as you alluded to earlier when you were talking about your history. What can be done to decrease the risk of breast cancer?
So yeah, this is really really exciting. There's so much that can be done to decrease the risk of breast cancer. I always let people know though that the risk is never zero. So I'm still a fan of screening. I had a normal mammogram at 41, and a year and 1 week later on a routine screening mammogram, I had a 2 centimeter mass that was invading my chest wall that I couldn't feel. I didn't have any symptoms. I had breastfed all three of my kids, didn't drink alcohol. So I thought I was doing all the right things, did obviously self breast exams. These hands were trained to find cancers in other people. And it was the most shocking call of my life. And so my breast cancer, I had that shocking call. I went in the next day, and and for the biopsy, and I sat in that room, and people kept walking by saying, like, why are you here? Oh, I'm so sorry. And I felt myself shrink, like, smaller and smaller. And I thought, if I'm ever going to make it through this, I'm going to need to use all that I have as far as lifestyle medicine with healthy eating. So I actually bought one of the little containers to grow my own broccoli sprouts while I was there. And I bought some pink tennis shoes, and I was like, I'm going to do what I can to embrace it. But as I was learning more and more about breast cancer, I was learning that so many of the same things that Dr. Banick just mentioned for eye health, for brain health, are the same things that are going to decrease the risk of breast cancer as well, and to be helpful for most breast cancer survivors too. So when it comes to the literature around risk reduction, I really like following the World Cancer Research Fund and the American Institute for Cancer Research, AICR. I'm not an oncologist, but I really, as an OB-GYN, as a breast cancer survivor, I really appreciate all that they do to go through the literature. So their recommendation to eat a diet rich in whole grains, vegetables, fruits, and beans, to limit consumption of fast foods and other processed foods that are high in fat, starches, and sugars, to limit consumption of red, and try to avoid processed meat, limit consumption of sugar sweetened drinks, limit alcohol consumption, or I would say avoid it. Um, you know, they recommend not using supplements for cancer prevention, for mothers to breastfeed if you can, and to be physically active and maintain a healthy weight. And so those are their core recommendations. As a breast cancer survivor too, I love looking at the literature around soy. There still is the misconception out there that women who are maybe at an increased risk for breast cancer, or maybe who want to just do everything they can to minimize their risk of breast cancer, that they avoid soy. And really, that is not the case. The phytoestrogens, the plant estrogens in soy are really good for overall health and well-being. In fact, we know that it's safe for women who are breast cancer survivors, such as myself, to eat, one to two servings a day of whole or minimally processed soy food. So I'm not doing the isolates and the supplements and all of that, but the edamame, the tofu, the tempeh, the soy milk. And those are great as well for menopause. So I, at 42, diagnosed with breast cancer, a bilateral mastectomy. I had 16 rounds of chemotherapy. I had my ovaries removed because of the type of cancer it was. And after doing that, I went through premature menopause. And so I was trying to go through figuring out like what are chemotherapy symptoms, what are menopause symptoms. And so getting hit by menopause, really started to dive into the literature around menopause to see what could be done as far as lifestyle too. And so many of the same recommendations that we hear for brain health and for breast cancer risk reduction are also really good for women during the menopausal transition and beyond. So that's an area that I've had fun really, really exploring. And I think that we don't do enough talking about the menopausal transition and menopause. And I get excited when I get a chance to share information about that.
Do you want to talk more about the transition to menopause and how, how a plant-based lifestyle contributes to an easier, I mean, this is what I hear. Obviously, that's not in my trajectory, but can you talk more about that?
So yes. So what we eat has a dramatic impact on the menopause transition. We know that, so first of all, there's some great research done by Neil Barnard with the Physicians Committee for Responsible Medicine on soy. And what they found is that they had a dietary intervention for vasomotor symptoms, which are hot flashes and night sweats of menopause. And it was a randomized controlled trial. So part of the group was randomized to a low-fat, plant-based meal or diet with a half cup of cooked soybeans a day. And what they found is that those who were randomized to the cooked soybeans, so the group that was the high soy intake group, that they had an 88% reduction in their hot flashes and night sweats. And so we saw some, there's, that placebo effect, we saw some in the other group as well, but we saw a significant reduction. And so not everybody who eats soy during menopause decreases hot flashes and night sweats. There's some differences in the microbiome we think that might be contributing to that. But a lot of women have an easier time with that transition if they're eating healthy foods. We know that women who have a higher intake of poultry and dairy typically have worse menopausal symptoms, and that high fat and high sugar, added sugar diets are associated with the increase in hot flashes and night sweats. On the other hand, women who eat more fruits and vegetables typically have fewer menopause symptoms, and women who eat a vegan diet, whole food plant-based diet, typically have fewer hot flashes and night sweats compared to people who are omnivores. So it doesn't necessarily help you to avoid all of the symptoms, but it sure can make the transition easier. And then we also have some great research with like the Nurses Health Studies 1 and 2 that looked at changes in plant-based dietary quality. And they found that those women who started eating more healthy plants, so more fruits and vegetables and whole grains and nuts and beans and seeds, those women typically had improvements in their physical functioning, fewer physical role limitations, less bodily pain, better general health. They also found that women who started to increase more unhealthy foods, even if they were plant-based, but people who just started to eat more ultra-processed food or junk food, because as we know, you can be a really unhealthy vegan. You can eat, all of your vegan junk food. And so those people who started to eat more of that food had worsening of physical functioning, more bodily pain, and more general health. They found the same thing. Those women who started to, during that menopause transition, those women who started to eat more high quality plant foods had improvements in their mental health and their vitality as well. So yes, huge fan of plants for many reasons, and especially during the menopause transition and for decades to come.